Friends, today I'm going to tell you about a wonderful treatment for heart care called natural bypass or counter pulsation. Now, what is that? People, when they get blocked tube, the doctor says that, look, this tube is blocked, I have to put a new tube. That's called bypass surgery. But they have to cut the whole body. They cut the tube from the hand, from the leg, from the chest, and then cut the chest and put the tube inside. That's a big surgery. Fortunately, God has given us an extra tube in the heart. Like we have two kidneys, one kidney is extra. Similarly, a lot of people don't know they have an extra tube in the heart. And these tubes are called capillaries and collaterals. These are in plenty and small ones, so they are called capillaries, and collateral because it is a backup tube. When you take a loan, bank loan, they say you give us a collateral. That means if you fail, somebody else will pay for you. That is the backup tube. God has already given the backup tube. Medical science has named them as collateral. And these tubes are already there, then why not open them up? Let me explain. These tubes are now closed. They are present in everybody's body, but they are closed. Why? Because we don't do running job. When we used to do running job, that time it was open. So everybody effectively used to run 1 or 2 hours per day, 3 hours per day. And that was good enough to open all these extra tubes. But now we have stopped that running job completely. So what happens? These collaterals are all closed off. Only the sports people are asked to run and run and run every day. So what will happen? They get so much of extra blood in the heart that the collaterals get pressurized and they open up. So these are also called sportsman's tube. The sportsmen have much higher physical capacity because of these extra tubes. So this is what we do. There's a machine called ECP machine or natural bypass machine, and you can see the machine. On this machine, we ask the patient to lie down. We wrap around some jackets around the cuff muscles, thigh muscles and buttock muscles, and the ECG is fed to the computer. The computer runs these jackets. Now, what is the technology? Technology is when the heart is pumping. It is called systole. The blood comes to the muscles, and next moment the muscles are again sending the blood back to the heart. This is called diastole, and during this time the heart is pulling the blood. So if you can squeeze the blood from the muscles and send them double, then there is double blood supply to the heart muscles. Remember, the heart muscles get blood supply only in diastole. Why? Because during systole the muscles are contracted, no blood can enter. During diastole they are relaxed, so a lot of blood can enter, and that time we are sending so much of extra volume and extra pressure blood. From 80 we make the pressure to 110, 120. So what happens? The heart gets so much of extra blood, so much of capillaries will open up, and this machine has to pump about 160,000 times. For 40 days we have divided it to 4,000 times approximately every day. So when a person heart is pumping at 72 times per day or 70 times per day, we do it for 1 hour, it is about 4,200 times. So 4,200 times into 40 days. So about 160,000 times the heart gets extra blood, and these are good enough to open the collaterals and capillaries. So effectively you have a second set of tube opened up and no cutting of the body. The only problem is with the cardiologists that they don't like this treatment. Though it is a US FDA approved treatment, 400 research papers have come out, and only after that a multicentric randomized controlled trial was done, and it was approved for angina, then heart failure. It's so effective that the government of USA, that is called FDA approval. FDA got an approval for this ECP machine. But the problem is with the money. The cardiologists, they know that doing a ECP for 1 hour can save them only 1,000 rupees, whereas a bypass surgery or angioplasty give them lakhs. So they don't prefer this treatment. So how to sideline them? They have said, okay, this treatment is good, but only for the bad patients. There where we have done a surgery, angioplasty, again bypass surgery, again angioplasty, now nothing can be done. Now you can get the treatment with this machine. But good patients, we don't want you to go for the machine, we want bypass surgery because the money is more. That okay, good patients, we will do surgery, bad patient will go for ECP treatment. Now this is what is wrong. I always stand by this ECP. I tell people, with lifestyle, with medical management, and then ECP, it works wonderfully well. So this machine treatment called natural bypass is now the future treatment. In all our clinics, 117 clinics across India, we are delivering this treatment, and the results are wonderful. I tell people that if you are keen on surgery, go for it. But if you are not keen on surgery, come, it will have the similar results. Nothing is replacing each each other. Everybody is existing. So angioplasty does not replace bypass. Bypass does not replace angioplasty. Both are coexisting. Similarly, this natural bypass is also going to coexist. Along with lifestyle, it is much more effective in treating heart disease. No surgery will be required, no angioplasty will be required, and the patient moves around without angina. So that is the power of that extra tube. God has given us the extra tube. Why not utilize them? So this is the treatment I want you to understand. And this treatment is getting more popular on public demand. Without the support of cardiologists, people say, sir, why to go for it? If I have extra tube, let's open them up. So, and it's outdoor treatment, completely safe. It's proven. So all that is adding up, and people are suddenly started preferring it as a mode of treatment, non-invasive mode of treatment. And I recommend it to every heart patient, whether he's angina, whether he has got a surgery or angioplasty, he needs a second surgery, second angioplasty, all of them should go for natural bypass. We call it counter pulsation also. Thank you so much.